Welcome to this short revision video on intrinsic risk factors for injury. As always, when we're revising, we need to make sure we're referring to the specification, so make sure you've got this document in front of you and that you're completing the word wall as we move through the revision video. So here's the specification content for this topic area. We've got intrinsic risk factors and extrinsic risk factors to look at, and in this video we're focusing specifically on intrinsic risk factors. So an intrinsic risk factor is an injury or a risk or force from within the body, and there are a number of different examples that we could use in our exam. So I'm going to break it down for you and try and help you to think about the best ones to use in sporting contexts. So we can see that intrinsic risk factors, the specification breaks it up into individual variables and training effects. So we're going to look at each of those two things separately now. So individual variables is about an individual's physiological makeup, a risk factor that's to do with the physiology of an individual or a sports person. So previous injury is a really good example of an individual variable, so an intrinsic risk factor for injury that specifically is about the physiological makeup of a person. It's a good example because previous injury is a risk factor for any sports person. So it doesn't matter whether the examiner gives you a specific sport or whether they ask you to use a sporting example of your choice. You could always use previous injury as a good example of an intrinsic risk factor under that heading individual variables. And for the same reason, poor posture is also an excellent example of this, because poor posture can affect any sports person. It doesn't matter what sport they're playing. If we've got poor posture and alignment, we're putting undue stress on tendons, ligaments, joints, and it could affect any sports person. So again, really good example because it doesn't matter whether the examiner gives you a sport or you get to choose a sport. Poor posture is an excellent example of an intrinsic risk factor under that banner individual variables. Another really excellent example is poor nutrition, and it's for the exact same reason, because nutrition is important for any sports person. We could use it in any example. It might be nice to use in a sport an example. For example, if we said poor nutrition because they're not getting enough protein, and this sports performer requires a lot of protein because they're a weightlifter or they're a rugby player, they require lots of muscle mass. But actually, nutrition is important for all sports performers. Age is another good example, but we've got to be careful here because age is only a risk factor if the players that a person is playing with are of a different age. And that links closely to body size as well. So if all the players are the same age and they're all a similar size, then actually there's no risk factor there. So we need to be careful when choosing age only if the ages of the performers are different. Obviously, a very young performer competing against people that are older, and similarly a very old performer competing against performers that are a little bit younger could both present some sort of intrinsic risk factor. And that links to body size as well, because again, body size is only an intrinsic risk factor under that individual variables banner if a person's body size is different to those that they're playing against. So there's a picture there of a rugby player who's quite a lot smaller than obviously his teammates and potentially a lot smaller than the opposition players, and that does pose a risk because if he's smaller in stature, he's more likely to suffer injury through a tackle. But if there's no difference in the body size between the players, then that wouldn't really be a suitable example. So individual variables then, just to sum up, variables associated with an individual's physiological makeup. The best examples are nutrition, previous injury and posture, because we can use those in any sporting contexts. Age and size, body size, are also good examples, but we've got to be careful to be specific that age and body size are only intrinsic risk factors if the age or size is different to the opponents, the people that they're playing with or against. So let's have a look now at training effects. So training effects is how insufficient or incorrect training might cause an increased risk of injury. And these are quite obvious, really. We've got inappropriate flexibility. And the reason that says inappropriate and not inadequate is that we can have too much or too little flexibility. So in a sporting example where flexibility is key, let's say in gymnastics or in dance, a low level of flexibility would be an intrinsic risk factor under that training effects banner. The person hasn't trained enough in terms of their flexibility. Maybe the gymnast or the dancer performs a split leap and they push their joint too far beyond its current range of motion and end up affecting and damaging the associated ligaments with that joint. But similarly, we can have too much flexibility, and these are good examples where in sports where there's a direct force potentially, so rugby, American football. If, for example, a joint, and it links to previous injury really, let's say shoulder joint has been dislocated in the past, the ligaments have become overstretched and there's a huge amount of flexibility then at that joint, it can mean that with a knock of force, that joint can become displaced, the bones can become displaced and it can lead to dislocation. So too much flexibility and too little flexibility can both be intrinsic risk factors for injury under that banner of training effects. And secondly, we've got inadequate fitness. I think this one's quite obvious. Although again, be careful with this because it's only a risk factor if the person has an inadequate fitness compared to those around them. So if there's a person, they're really not very fit, they've got a low aerobic capacity, but actually their training program is designed for them and they're not trying to push themselves too hard, then that low level of fitness is not a risk factor. It's only if their fitness is inadequate for what they're trying to do. So if a player has a lower aerobic capacity and they're trying to run with a group of other people that are fitter than them, that have a higher aerobic capacity than them, then that would be inadequate fitness and that is a risk for injury. Similarly, if the training program is requiring too much of the individual, the progressive overload is occurring too quickly, there's not enough rest, because they're not fit enough, then again, inadequate fitness would then count as an intrinsic risk factor under that training effects banner. So again, just to sum up, training effects is how incorrect or insufficient training might cause increased risk of injury. We've got insufficient or incorrect flexibility, inadequate fitness. Sleep is also another good example there under poor preparation. If a player doesn't get enough sleep, they're not well rested, then that also could lead to intrinsic risk factor for injury under that training effects. So a summing up of intrinsic risk factors then to finish. Intrinsic risk factors, these are injury risks or forces from within the body, and the specification is splitting them into two headings: individual variables and training effects. Individual variables is about an individual's physiological makeup. The best examples are poor nutrition, previous injury, and poor posture and alignment. Other good examples, so long as we make it clear what we mean, are age and body size. And finally, training effects, how insufficient or incorrect training might cause increased risk of injury. We've got inadequate fitness, inappropriate flexibility, and inadequate sleep.